How we doing? Welcome to another Lunch and Learn. We want to thank Chief Montminy for being here again. He'll be introducing our speaker. Thank you. Just a couple of announcements, just to let you know. Next Wednesday, there will be the annual Uxbridge Elderly Connection meeting. That's at 5 o'clock here at the Senior Center, if you are interested in attending that. Also, a couple of things happening out in the community. We have the Woo Sox game for the town of Uxbridge takeover on May 24th. There is no transportation for that, but yet you can go online and get tickets if you're interested. It's always a fun event. Also, the Pebble Art class is the sign-up sheet. It's on the bulletin board. There's one slot left for that. If you are interested, that's going to be here on June 3rd at 1:30. And it's a pretty cool craft that they're doing, so check that out. That's sponsored by the Elderly Connection. There's pictures on the board of what you'd be making. Also, Memorial Day, there's a pancake breakfast at St. Pat's Church in Whitensville, May 27th, if you're interested in going to that. And then the Sheriff's Picnic, the sign-up sheet's still on the board for that, if you're interested. That's going to be June 8th. And we have to RSVP to them by May 20th, if you're interested in that. Also, I hear that there's someone's birthday today.
You hear?
Sally's birthday's today. Can we all sing to Sally? Happy birthday to you. Happy birthday to you. Happy birthday, dear Sally. Happy birthday to you. And many more. What is it, 25 today?
I'm 55 and proud.
Okay, 55. She's still a young whippersnapper.
That's what my twin sister said.
I wish I was 55. All right, let's do a moment of silence before lunch. Thank you. Enjoy your lunch.
Ladies and gentlemen, welcome to another Lunch and Learn. While you're eating, we're going to have our presentation. I have an announcement for you. The police department is in the process of hiring 3 new police officers. So at some point, perhaps what we'll do is we'll bring one of the new people by to talk to you and introduce themselves. In the past, you've always enjoyed that. So 3 new police officers coming on in the next couple of months. That's good news. Oh yeah. We already got the individuals selected, and they're in the process of getting uniforms and training and all that kind of stuff. So, like I said, in the coming months, maybe what I'll be able to do is bring some of them by to introduce them to you. On other news, we're preparing for the retirement of Bear. Does everybody remember Bear, our canine? Yeah. Bear's over 9 years old, and usually 10 and a half is about the working span of a police work dog. So we have to start preparing. Already he's on arthritis medication. Anybody familiar with that? So he's on medication already. So we're getting prepared to retire him at some point in the future. And maybe what I'll do is before he retires, I'll bring him by again. Okay? Okay. Well, once the dog retires, he becomes the pet of the handler. Yeah. Yes, we're getting a new one. Yeah. So what we want to do is we want to have the new dog ready before we let Bear retire. You know. So it's going to be a year or so.
Well, who's going to be the new?
We don't know yet.
Okay, so it won't be.
Well, it could end up being the same guy, but applications are out right now for people who want to be dog handlers. I got to tell you, being a dog handler is not as easy as you think. It is constant work, and of course, you never get away from it because you got to bring the dog home with you.
Yeah.
So
Yeah.
it requires that the family be okay with that too.
Yeah.
Because you get paid, sure.
Was it a paid position?
Oh, yeah.
My dog is a dog trainer.
Yeah, so, yeah, no, but the dog gets health care for life.
As he should,
Thanks to you taxpayers, right?
as he should.
So, today, we have a great speaker for you. If you remember, every time I talk to you, I tell you about a great speaker we have. So this great speaker is Lori. Jerry? We have Lori Hout with us here today. Lori is from Family Continuity, who services the entire region and very helpful to the police department. Whenever we come across a situation, either mental health, substance abuse, or anything else that we don't know how to handle, we call Lori. So we love Lori at the police department, and she's going to tell you a little bit about what she does, okay?
Thank you, Chief. Hi, everyone. As the Chief mentioned, my name is Lori Hout. I do work at Family Continuity in Whitensville, and we are affiliated with Advocates. I'm a social worker. I'm also a recovery coach, and I think it's important to note that I'm a woman in long-term recovery from alcohol. And I say that in case any of you have loved ones, or if you yourself are in recovery or are currently experiencing any kind of substance use difficulties. I try to make sure that the stigma of mental health and substance use are eliminated. It's something to talk about. And I'm not here specifically to talk about substance use today. I want to explain to you what my program is, talk a little bit about some of the things that we see and the ways that we help, and also give you some resources that you might be able to use in the future if you ever experience any difficulties, or if any of your loved ones experience difficulties. So my program is called the Blackstone Valley Connector. As Chief Montminy mentioned, we do work with the Uxbridge Police Department along with seven other police departments in the Blackstone Valley. We are funded through the Department of Mental Health in Massachusetts, and what we do is we receive referrals through the police departments. Maybe there was a 911 call, or maybe a police officer just came upon someone that seemed to need some assistance. We will reach out to those folks. We will reach out to family members or the individual. It could be that they're having a hard time with some mental health, some emotions. It could be that they're having a hard time with substance use, or perhaps homelessness or other issues. It could be that they are having a hard time accessing benefits or medical care, and we'll try to guide them through that and navigate the systems, which can be very, very challenging. So we provide sort of a flexible service, I would say, and that being said, I've been doing this for almost 6 years, and it's always surprising to me how welcoming folks are when I reach out. You might think that if I'm calling you after a 911 call, that people are resistant, that people are reluctant, I should say, to talk with me. And I found that 90% of the time, that's not the case. I'm calling people as another person. I'm calling people as a person who cares, as a person who maybe has been through similar things, as a person who has seen similar things, and just to provide some support in whatever it is that's going on. It might have nothing to do with what the police have told me. It might have nothing to do with what the 911 call had to do with. It might just be that things are really tough right now. When I reach out, I am open to listening. That is the first step. And what I hear from folks is that they're feeling like they're going crazy. They feel like they don't know which way is up. Maybe they feel like there's no solution. There's no answer to the problems that are happening. There's no way to make things better. And that's often not the case. We try to find those solutions with folks. Some of the things that you might call mental health, or you might just call emotions, that we see and we're willing to talk with folks about, that maybe they're sad. Maybe they're really feeling hopeless, which can lead to risk of suicide. They may be feeling really angry. lonely. Sometimes when we get older, we have a hard time thinking clearly. That can be really stressful and sad and upsetting. Maybe they're using alcohol or drugs, or maybe there are some interactions with their medications where it's affecting their minds. That's something that we can talk about. Maybe those emotions that they're feeling are just too much and they're not able to control them. And that's okay. It's okay to be in that situation. But it's not a fun place to be, right? We don't want to be in that situation. So talking to someone can help. Sometimes it's that you cannot feel joy, no matter what is happening. And that's okay too, but it's not a good place to be. It's important to talk to someone about it. And the other thing that we see oftentimes is that there's a family member. It could be someone who's in your own generation. It could be someone who's older or younger than you. It could be someone that's living with you or not, but they're having a hard time. Maybe you can't understand why they're doing the things that they're doing or experiencing the things that they're experiencing. These are all really great reasons to talk to someone. And part of the point in me being here is to let you know that you don't need to be ashamed if you need to talk to someone. It's just another person. It's just a person like me. I get a little emotional because I'm very passionate about my work. Thank you. So again, my goal when I'm doing this work is to help people be happy, and maybe that's to be happy again or for the first time. The first thing that I do is listen. I mentioned that before. The second thing that I do is to be kind and supportive, no matter what. And the third thing that I try to do is to provide resources and solutions. Sometimes that takes some time. It takes some getting to know one another, trying to understand what's going on in a person's life. And what I really want to share with you is that I am not the only person out in the community that is doing these things. If you have a 911 call, you may be referred to me, and I might call you. I might reach out to you and offer you support, and if you say, I really don't think I need anything right now, I'll say to you, is it okay if I reach out to you again in a couple of weeks or next week? Usually people say yes. Maybe the next time you'll be ready to chat. And sometimes that one phone call is all that's needed to make someone feel like there is a community around them, like they're supported, like people care. So additionally to my program, the other thing that I really wanted to talk to you about is what else is out there. So if you haven't been referred to me, that's okay. But the state of Massachusetts has begun to change the systems of care around mental health, around emotional and behavioral health. I've brought with me some flyers that explain some of the changes in a very simple way. I think that it's confusing if you don't have this flyer. So I really want you all to take this, whether it's for you or if it's for someone that you love. Just keep it around. The first thing that I'm going to talk about is 988. If you feel like you are in crisis and you need to talk to someone right away, or if your loved one is in crisis and they need to talk to someone right away, their emotions are up here or down here, you can call 988. If you just need someone to talk to right now because you're starting to feel a little bit like you don't know which way is up, you can call 988. This is one leg of the new services. 988 was originally the suicide hotline, but that is not all it's for. You do not have to be suicidal in order to call. And frankly, most of the people that call are not suicidal. They can connect you to resources, but they can also listen to you in the way that I listen to people when I'm out in the community. In the middle of this chart is the Behavioral Health Helpline, or BHHL. There's an 833 number on there. You can call or text. And this is if you feel like you need treatment or your loved one needs treatment. So maybe someone has substance use. Maybe someone is not quite thinking right. Maybe they are suicidal. Maybe they're having panic attacks. You can call that number or text that number or go on the website and someone will talk to you right away. These are both 24/7. So that is another path. That is a path to treatment. And lastly, on this chart over on the right is the CBHCs, which are the Community Behavioral Health Centers. The Community Behavioral Health Center for this area is Riverside Community Care in Milford on West Street. If you call 988 or the Behavioral Health Helpline, the 833 number, they may tell you that it is a good idea for you to go to the Community Behavioral Health Center. But any of these methods will get you to some support. And they will guide you. And if they think that it's best for you to call 911, that is what they will tell you. And at that point, you will have potentially my colleague, Ashley, who's working with the Uxbridge Police Department. She may be there to help you, or she may follow up with you, or I may follow up with you. So the message here is that there is support available. You don't need to feel bad about asking for support. We all need it. When we get older, things get more complicated. The systems are complicated. We're taking medications. We're losing our loved ones. And we've perhaps retired and had to change our entire lives. Things are different. It's really important to know what available supports are there so that you can access those when the time comes. Thank you.
Thank you. Lori's great, folks. Police department uses her services all the time. Oftentimes in public safety, we come across somebody who needs something that is not something that the police department can't provide. And when that's the case, we call Lori, and she always steps up for everybody in the community. She's a good ear. She listens well, and so I encourage anybody who doesn't know how to navigate the system. This is how to navigate the system. So thank you all, and we look forward to seeing you again next month.